clinicians, we have a commitment to care for our patients, and increasingly, one area of care we need to address is their financial health as it relates to their health care. The cost of care for individual patients is increasing, and many are experiencing financial burden as a result. In fact, healthcare costs are the #1 cause of personal financial bankruptcy today. Given this situation, we as clinicians need to understand the impact that our treatment plans will have on patients and their families. Just as we routinely screen for depression and other health risks, we need to start routinely screening for financial distress and discussing the costs of the care we recommend. Almost all clinicians have experienced times where patients went without medical care or didn't complete the diagnostic or treatment plan because they couldn't afford it. If you discover that cost is a barrier for a specific patient, you may alter the plan accordingly, refer the patient for financial counseling, or provide the patient with a list of services or strategies that might be helpful. Addressing costs of care is not something that we as clinicians have been routinely doing. Recent studies on out-of-pocket costs reveal that about 70% of patients want to talk with their clinician about out-of-pocket costs, but only 28% say they have. Right now, you're likely thinking one of 3 things, if not most or all 3. First, you're thinking that there's just not time to add another conversation to the exam room visit. Second, you might be thinking that even if you did have a conversation, how would you know how to help your patient? And third, you might be wondering if your patient would be insulted or embarrassed if you brought up issues relating to cost. Well, in regard to concerns about time, recent research has shown that these conversations don't need to be long. In fact, effective conversations can be held in as little as a minute. Second, you don't have to personally know everything about how to help your patients financially. There are multiple resources available to patients, and you just need to let them know the resources exist. You might designate someone in your office as the go-to person for patients to talk to, or if that's not feasible, you might have a list you can give to patients who need help. ACP has developed such a list to which you can add any local resources available in your community. Additionally, ACP has developed a portfolio of free educational resources to help you deliver high-value care by adapting your care plan to meet a patient's individual needs, including cost concerns, and by helping to avoid unnecessary tests and treatments. Finally, the vast majority of patients are grateful when you bring up costs. Patients have commented that they value transparency and feel that talking about cost with their medical team promotes a stronger relationship and greater trust with their doctors. Of course, it's very important that you normalize these conversations by sharing that you have them with all your patients, not just some, since you can't tell just by looking at them who might be struggling financially. In addition, reassure patients that your goal is to help them live the healthiest life possible and that the quality of their care will not be negatively affected by talking about cost concerns. One model to guide your conversation is the 4E model, which includes engaging, emphasizing, educating, and enlisting. You engage with your patient to build and sustain trust in the relationship. You emphasize that you understand costs might be a concern and you want to help ensure the patient can get the care they need. You educate the patient on options and resources available to them. And finally, you enlist the patient as a partner in helping to address any cost barriers. While this might feel daunting at first, once you try this approach in practice, you'll find that it is a relatively quick and valuable way to improve patient outcomes. Just by starting the conversation, you create a safe space for patients to bring up future cost-related concerns and increase the chances your patients will follow through on their care plan. One doctor always includes cost as a possible side effect to anything he orders or prescribes, and this invites future conversations and a more open relationship with patients. Talking about costs of care is good health care. If you haven't started doing this yet, now is a great time to start. And if you have, try expanding your discussions to all of your patients and identify other members of your team that can pitch in and help with screening patients for financial distress or working with them to identify helpful resources. Let's all together work to improve trust, communication, and patient outcomes.